Hi, I'm Cynthia, and today I'll be discussing 5 medications that EMTs are allowed to give. In order for an EMT to give medications, we must obtain medical direction. We must also know the 6 rights, which is the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. The first medication we'll talk about is epinephrine. Epinephrine is given to persons who are having severe allergic reactions such as anaphylaxis. Now, adults will get 0.3 milligrams and children will get 0.15 milligram of epinephrine. The route of administration for the epinephrine is it is an auto injector, so it's given intramuscularly. And contraindications for epinephrine: if the person is having chest pain, if they are hypothermic, or if they are hypotensive, you may not give epinephrine. So it's important to obtain vital signs before giving any medication. The side effects may include nausea and vomiting. Our next medication is glucose. Glucose is given to patients who are hypoglycemic, meaning they have low glucose level. However, in order to give the glucose, these persons must be alert and oriented. If the patient is not alert or oriented, you may not administer glucose, and the glucose is administered at a half tube to 1 tube for the patient. Also, vital signs must be obtained, and contraindications of glucose: they may have nausea and vomiting. Next medication is nitroglycerin. Nitroglycerin is given to patients who are having cardiac related chest pains. The route is via the mouth. So nitroglycerin comes in a pill form and it comes in a spray form. So for the pill, the patient gets 0.3 to 0.4 milligram and they'll chew the tablets. For the spray, it's 0.4 milligrams, one spray under the tongue. This may cause a burning sensation under the tongue. They may feel nauseous or they may have vomiting as well. Contraindications for giving nitroglycerin: if the patient is hypotensive, meaning they have low blood pressure, if they have bleeding, we may not give nitroglycerin, or if they have head injury. Also, if the patient has taken any medication for erectile dysfunction within the last 24 hours, nitroglycerin may not be given. Our next medication is aspirin. So aspirin is given for headache, fever, or cardiac related chest pains. It's a chewable tablet and it's given 160 to 325 milligrams, and it's via mouth, so it's a tablet that you must chew. Side effects of aspirin is nausea and vomiting. Contraindications of aspirin: if the person has hypotension or bleeding, you may not give aspirin. Next up is oxygen. So oxygen is given to pretty much any patient that has a respiratory distress, has difficulty breathing. Contraindications to oxygen is not to use near open flames as it's a combustible substance, and also we try to refrain from giving COPD patients oxygen as they have a high hypoxic drive. However, we do not withhold oxygen from any patient. Oxygen is given in various forms from 28 to 100%. It's given via nasal cannula, non-rebreather mask, or positive pressure ventilation. And oxygen, as I stated before, we don't withhold oxygen from COPD patients. However, we rarely give oxygen to COPD patients because of the hypoxic drive. That's one of two contraindications of oxygen. And that concludes my video on pharmacology. I'm Cynthia. Thank you.